Hello, my name is Christina Gainey, and today I'll be discussing the approach to the management of alcohol-associated liver disease during the COVID-19 pandemic. Due to social distancing, decreased access to programs such as Alcoholics Anonymous, and the psychological impact of the pandemic, patients with alcohol use disorder and alcoholic liver disease are at much higher risk of relapse. It's important to consider a multidisciplinary approach to the treatment of alcohol-associated liver disease, including regular scheduled telehealth visits and counseling, access to pharmacotherapy, use of technology such as mobile applications. And liver transplant centers will need to consider a more flexible approach to requirements for patients with alcohol-associated liver disease, and think about how to best monitor and support these patients over time. Our case involves a 50-year-old man with a history of cirrhosis due to alcohol use, male of 20, who was listed for liver transplantation prior to the start of the COVID-19 pandemic. He then tested positive for SARS-CoV-2. He received a status 7 letter in the mail, mistook it as a delisting letter, and became severely depressed. He drank a 12-pack of beer a day for 8 days until his wife called the transplant coordinator for help in treating his depression. Prior to this event, the patient had been sober and abstained from alcohol for 8 years. A clinic visit was scheduled by his primary hepatologist via telemedicine to discuss his recent alcohol use. By the end of the visit, the patient expressed feeling motivated and encouraged to stay sober. The social worker contacted the patient, offered him Alcoholics Anonymous resources, as well as further psychosocial support. Over 3 months after the clinic visit, the patient was admitted to the hospital for an episode of severe acute decompensation of his cirrhosis. Meld was now 40, complicated by active GI bleed and hepatic encephalopathy. Per wife, he had been drinking heavily for the past 2 to 3 months and had not participated in any virtual AA meetings. He was discharged on home hospice and died shortly thereafter. So what can we learn from this case? Compared to 2019, numerous studies have found an increase in alcohol sales and consumption. Nielsen reported a 54% increase in national alcohol sales in March 2020 compared to the same time in 2019. Self-reported alcohol consumption increased by an estimated 14% overall. Women in particular exhibited a 41% increase in alcohol consumption over a 2019 baseline. Another study found that for every 1-week increase in time spent at home during the pandemic, there was a 1.19 greater odds of binge drinking. The same study also found that binge drinkers with a previous diagnosis of depression and current depressive symptoms had greater odds of increased alcohol consumption compared to those with no depression. There are numerous factors for relapse, and people may be self-medicating to deal with the uncertainty and stress. Social isolation, disruption of normal routines, financial difficulties, psychological distress of quarantine can all drive people to drink alcohol. Comorbid psychiatric disorders and polysubstance use disorders can be exacerbated, especially if patients are having decreased contact with their healthcare providers or having difficulties obtaining medications. Decreased interactions with healthcare providers and poor health literacy and language barriers can also contribute, as well as decreased in-person meetings and decreased access to programs such as Alcoholics Anonymous. So how do we continue to support sobriety during the COVID pandemic? We must continue to maintain patient contact via phone, email, patient portal messages, and regularly scheduled telehealth visits. We should refer patients to online AA meetings, which have largely expanded due to social distancing. It's important we educate patients about the mental health risks during the COVID pandemic and where to get help online. And crisis lines are essential when substance use can lead to suicidal ideation. And it's important to ensure that patients have plenty of medication refills and have the ability to call and request refills if needed. The most effective treatment for AUD is a combination of psychosocial interventions and pharmacologic therapy. Treatment needs to be multimodal, including treatment by primary care, social work, psychiatry, as well as addiction specialists. Patients also must be screened and treated for comorbid psychiatric and substance use disorders as well. Referral to support groups such as Alcoholics Anonymous is imperative. And hepatologists in particular must be more comfortable with techniques such as motivational interviewing. There are currently 3 FDA-approved medications for the treatment of alcohol use disorder. Only 2 are safe to use in alcoholic liver disease. Disulfiram is contraindicated. And only acamprosate is safe to use in advanced liver disease. The combination of medical management with either naltrexone or acamprosate has shown excellent results for treatment, with about 6 to 7 patients needed to treat in order to achieve a good outcome, which is similar to those seen in other chronic conditions such as depression or type 2 diabetes. There are multiple off-label medications that may be helpful in treating alcohol use disorder, but few have been definitively studied in treating patients with advanced liver disease. Baclofen has actually been shown to be effective and safe to use in the treatment of alcohol use disorder in advanced liver disease, and it is recommended by both the European and American Associations for the Study of Liver Disease for treatment of alcoholic liver disease. So what are the special considerations for transplant centers? It's incredibly important to increase and maintain communication, coordination between various services, especially during the pandemic, when face-to-face interactions have decreased significantly. Studies have shown that integrated treatment programs within transplant centers have reduced relapse rates and improved outcomes. Use of routine measurement of alcohol biomarkers is vital to help identify alcohol relapse and support recovery. And empowering family members to come forward with concerns is also another way to ensure that we will hear about patients who begin to struggle. Thank you so much.